Good morning, everyone, and welcome. So this webinar is part of the Girls Not Brides learning series for March, which is focused on sharing learning on solutions to end child marriage. So we kicked off the learning series in January with an introduction to what we know from the evidence on what works and what doesn't work to end child marriage. In the next month, we did how to address child marriage through social norms work. And this month is really focused on what are the roles of laws and policies in addressing child marriage. So the objectives of this webinar is very much around to give you a bit of a snapshot around the current status of national strategies to address child marriage globally, to highlight ongoing research by Girls Not Brides and the World Health Organization on research on subnational multi-sectoral implementation, so how to translate national strategies to the ground in terms of meaningful change for girls. And it also looks to highlight national examples through examples from India and Uganda of different subnational implementation work, and also calling for action in terms of the need to document the learning around implementation and what works and what doesn't work. So today we're very lucky to have with us speaking Marina Plessens, who's a consultant with the World Health Organization, Priyanka Srinath from Mamta Health Institute for Mother and Child, who will be speaking about the collective response of the government to end child marriage at the district level, Rajasthan. We'll have a presentation by Harriet Akulu, a child protection specialist from UNICEF Uganda, on some of the challenges, successes and lessons learned in implementing the National Action Plan to End Child Marriage at the district level in Uganda. And finally, we'll have Claudia Laforte, consultant from Child Frontiers, to talk about some of the early findings coming out from the joint research by Girls Not Brides and WHO on the lessons from different sectors, what we're learning from other sectors that we can apply for implementation of strategies on child marriage. And then that will be followed by a Q&A and then a wrap up. So I'm going to jump into this by giving you a very quick snapshot of national strategies to end child marriage globally, and to give you a sense of why we're focusing so much around implementation. So I apologize in advance that I will be going through some of this information somewhat rapidly. Don't worry, this presentation will be available online afterwards, and it's also being recorded. So you will be able to get that information if we do go through it rapidly. Next slide. So in terms of the global landscape, many of you would be quite familiar with these numbers, but just as a reminder that we've got each year 1 in 5 girls married before the age of 18. So that's 650 million women alive today who were married before the age of 18 years. And as you can see from the regional figures, it's truly a global issue. Child marriage cuts across countries, cultures, regions, religions, and occurs in both stable and fragile contexts. Next slide. So because we're talking about national strategies to end child marriage, what I just wanted to touch on is that we see a number of these strategies emerging from those countries that have either a very high prevalence of child marriage among girls before the age of 18 years, or in countries that have the highest burden, namely the highest absolute numbers of women in a country but married before 18. I've included this slide because it's important to keep in mind when we're thinking about national strategies that you have the countries with highest rates but burden also. And just for reference, the figures here are based on DHS and mixed data, and they're all available in the 2017 UNICEF State of the World's Children report. Next slide. So what's the progress that we've seen? I just want to give some context to this because there's been a lot of work happening around the implementation of national strategies, and a lot of research has already happened. We're not just coming to this cold. So in terms of the global level, we've seen a lot of progress on child marriage and a recognition of the urgency to address it, particularly in the last 6 years. So we've seen the introduction of biannual resolutions on child, early and forced marriage at the Human Rights Council in Geneva and the UN General Assembly in New York. We've had numerous summits, international days like International Day of the Girl Child, which have thematically featured child marriage, and of course the inclusion of Target 5.3 to end child marriage by 2030 in the Sustainable Development Goals. And that's really just a glimpse because there's so much that has happened at the global level that isn't included there. Next slide. At the regional level, we've seen a lot of movement on child marriage as well. The African Union's continental campaign to end child marriage has now been launched in over 25 countries. The Southern African Development Community has developed a model law on child marriage that they're looking to roll out at the national level. The South Asia Association for Regional Cooperation, or SARC, has a regional action plan that 9 countries in the regions have signed up to, as well as many other regional commitments to end child marriage. And increasingly, we're seeing in Latin America and the Caribbean, where countries like Brazil and Mexico are in the top 10 highest burden globally for child marriage, we're seeing the Organization of American States and national governments putting child marriage and early unions on the political agenda. Next slide. So at the national level, we have a lot of learning and have done a lot of work on what it will take to end child marriage. And this broadly comes down to 4 key areas of intervention. Number 1, empowering girls. 2, mobilising families and communities. 3, providing services and system strengthening. And 4, establishing and implementing laws and policies. So in order to deliver these 4 areas of intervention in a comprehensive and holistic way, what we see is often needed is a whole of government approach to delivering on these 4 intervention areas, which is where national strategies on child marriage come into the picture. So what is a national initiative to end child marriage? So it comes down in many forms, national strategies, often very high level document which outlines a vision, strategic directions for action. The National Action Plan. So this is usually a lot more detailed in terms of the documentation. It will often have an M&E framework, it'll be costed, it will have an implementation or operationalization plan, roles and responsibilities across sectors are allocated, etc. And then we also see at the national level, national campaigns, like the African Union campaign. These we often see more an agenda setting exercise, a more public communications approach. So, the national level, the meaty stuff. What progress have we seen in concrete terms at the national level? So, we've seen the development of a number of national strategies and action plans on child marriage. So, we've got 14 launched officially by government, as you can see on the slide, and we have another 18 in development. And I will caveat that by saying these are the national policies that we've tracked in the past 6 years. This doesn't actually encompass those existing policies that are out there that we are currently mapping to see to get a truly global picture of national policies in all countries. Looking at in terms of looking at the national initiatives launched, what that means is that the government has officially endorsed and launched that national plan to address child marriage holistically. The list where it says national initiatives and development refers to, that could mean a number of things. For example, a government might be at the start of having consultation processes for the development of a national strategy. It might mean that a draft document has been through a consultation process, formative research done, and that it's waiting for endorsement by the government. It really depends where they are in that phase. And when we're talking about these national strategies, some of these are national strategies to end child marriage in a certain country. But what it's really important to point out is that many other strategies look at child marriage through other sectoral strategies, such as ending violence against children, an adolescent strategy for the country, a teen pregnancy strategy, sexual reproductive health and rights, etc. And so it's really important to realise that you can address child marriage through those other sectors. Next slide. So just very quickly, I wanted to make the point that we have done a lot of research in 2015 and 2016 looking at the different lessons emerging from the development of these national strategies. And there are a number of interesting lessons that have come out from these two. Because it's older research, I'm not going to focus too much on it, but it is available if you're interested in those lessons that come out from the consultation processes, the development of national strategies. Next slide. And from that research, 4 key lessons have come out, very much at the national level though, looking at, for example, government leadership being critical, and that it's really important that government has to set the political agenda for tackling child marriage at the national level. The second lesson, next slide, and these will be available on the website, and there are reports on this. This is why I'm rushing through these key lessons, which are a few years old. But a second big lesson being that coordination and communication across different sectors and at different levels, national, subnational, local, is absolutely vital. Next slide. The third lesson is that civil society has to be involved in the development and implementation of national strategies. This is for 2 big reasons. The firstly is that civil society is uniquely placed. They have a critical role in knowing how to reach the hardest to reach girls, the most vulnerable, the most marginalised, the most remote. They have that role in making sure that no girl is left behind where they might have otherwise been missed by a mainstream government intervention, for example. They also have that critical role in holding governments to account with the development of national strategies, as long as they can advocate collectively with one voice on child marriage. The fourth lesson is that a multi-sectoral approach is critical. That child marriage isn't a standalone issue, shouldn't be seen as one that it's vital to engage all different sectors by approaching each sector with a clear message of why child marriage matters for them, talking the language of each sector. So this research culminated in 2016 into a checklist for national strategies, which is available on our website, and as a guide to help reflection and analysis in the development of a national strategy. And in terms of how that checklist was structured, it covers 3 things. It looked at the strategy development process, so the consultation processes, the research and evidence that's needed to inform strategic direction of the strategy. This part of the strategy usually takes 9 to 12 months, although there's no hard and fast rule on this. The second, you can see in red, looks at the content of a strategy. What actually goes into it? What's the goal and vision for the country? How do you prioritise the often many competing interventions that you need to make for girls, for families, for communities, for systems, for services? How do you prioritise those? And then the third part, in purple, focuses on the hardest part. This bit is about how do you take that lovely, shiny, beautiful policy document, the national strategy that you have developed, that has just been launched with a lot of fanfare, perhaps a summit. How do you take that and implement it? How do you take that holistic national approach? How do you take those interventions to girls themselves, and what does the implementation look like? How do you do it? How do you work and coordinate across sectors? How do you finance the whole thing and track that money and make sure it goes to where it needs to go? And what's the role of local government, of donors, of UN agencies, of civil society, of law enforcement, all these different actors at all the different levels in implementation? So there's no silver bullet to answer this, but there is a lot out there in terms of learning of what has worked in other sectors, nutrition, for example, GBV, maternal health, that we can learn. So today this webinar is really focusing on that learning about implementation at the subnational level, and really thinking through what can we take and apply to our work in child marriage? What will help us take those 30+ national strategies we have launched or in development and make sure they're implemented to make real change in the lives of girls? So on that note, I'm going to hand over to Marina Plessens from the World Health Organization to share about WHO's interest into the topic. Over to you, Marina.
Great. So first, I'd like to say thank you very much to Girls Not Brides team for organizing this important webinar as part of their ongoing learning series. And also thank you to Matilda for her excellent introduction to the current status of national strategies to end child marriage globally as a framing for our discussion today. As Matilda said, my name is Marina Plessens, and I work on adolescent sexual and reproductive health at the World Health Organization. We do a substantial amount of work on child marriage, given its implications for the health and well-being of girls, their future children, and societies, but also as a poignant human rights issue in itself. I'm pleased to be able to share a bit about our interest in this issue and of intersectoral convergence to prevent child marriage in particular today. But first, I want to step back for a minute and say that this really is a timely webinar given UNICEF's newest estimates, which were released in early March. They found that 12 million girls marry each year before they turn 18, which is a drop from the previous estimate of 15 million. While this is good news, there's much more that needs to be done. To end child marriage by 2030, the target that was set out in the SDGs, progress needs to be significantly accelerated. And further, while the global declines are really encouraging news, we have to recognize that child marriage is moving from a widespread phenomenon across populations to really a localized one. In India and Ethiopia, for example, we see that child marriage is decreasing overall, but is either stagnant or even increasing in selected areas. So we see that immense variability in child marriage exists across countries and states, which really underscores the importance of subnational analyses and action. A perfect segue into today's discussion. So, okay, great that we're on this slide, perfect. So first, I want to start off by saying that there's an abundance of evidence on the numerous social, educational, and economic drivers of child marriage. And as a result, we know that limited scale and non-integrated approaches that address only some of these drivers are only narrowly effective. We also know that health, economic, and social consequences of child marriage, which can be lifelong and intergenerational, span the mandates of many government ministries or departments, which signals the relevance of working on this issue for many sectors. Next slide, please. So convergence approaches, I'll give you a quick definition. They use multi-sectoral or multi-level institutions to jointly address an issue. And we know that these have been largely underutilized in prevention of child marriage. We know that relevant sectors like education, social protection, health, public information, and justice have been brought together to make complementary contributions to prevent child marriage in the context of research studies and demonstration projects. But we also know that this is really not easy to orchestrate in real-world large-scale programs. So for example, I've provided a diagram from a program called Programa Geração Biz, which is a multi-sectoral initiative that was piloted in 1999 in Mozambique to address adolescent health broadly, but child marriage as a component of it. And it shows the respective roles and responsibilities of 3 government ministries. You can easily see, even conceptually, how this can really become quite messy in practice. Next slide, please. Meanwhile, there's very scarce literature on how convergence is really operationalized, the nitty-gritty of that, and the mechanisms required to ensure effective service delivery, especially related to effective strategies for designing, implementing, and then critically important, evaluating these processes. Next slide, please. Work in other areas, meanwhile, point to important considerations that we can take into account. So let's take nutrition, for example, which is an area that really led on multi-sectoral convergent action. Lessons from this field, in this case of the paper shown here, in the case of the context of Bangladesh, Bolivia, Guatemala, Peru, and Vietnam, showed that, for example, differences in institutional mandates often lead to lack of sound coordination mechanisms across departments, and then also dissent among mid-level actors in formulating and agreeing upon intervention strategies, and then how they can be rolled out and monitored. Next slide, please. Lessons from a qualitative institutional study in Ghana, Mozambique, Nigeria, and Uganda showed that resources are a critical component to consider. So for example, policies and agencies that have cross-sectoral scope, which is a really important factor for multi-sectoral coordination, do not usually fit into the sectoral pattern of resource allocation, and thus ministries may view themselves as inherently in competition with each other. Next slide, please. Lastly, in the context of Senegal and Colombia in the first paper you see there, and then India in the second, They point to a number of factors that need to be in place in order for intersectoral convergence with high-level political support and processes must have. So for example, a wide variety of stakeholders involved. Those stakeholders can be within the government at different levels, from the national level to the subnational level, all the way down to frontline workers, and outside the government. For example, with resource organizations from civil society playing a key role in many contexts. Second, a shared vision and motivation and commitment that is importantly sustained over time. 2, capacity strengthening. 3, joint accountability with effective management approaches combined with operational flexibility to accommodate real-world problems. And supervision mechanisms and monitoring and evaluation that cuts across sectoral boundaries. Next slide, please. So in the context of child marriage, we need knowledge on a few things. We need knowledge on the systems and mechanisms that can be put in place to promote and ensure convergence. And I've shown this wonderful diagram that Girls Not Brides has developed with ICRW on the important roles that different key ministries or departments can play. Then we need knowledge on the systems that can be used to track convergent action. We need knowledge on facilitating and hindering factors in diverse contexts, both in terms of social and cultural context, but also in terms of political context, decentralized versus centralized systems. And then we need a clear indication of the value added to program impact in order to advocate for this type of work in the larger context. So this is broadly the motivation for our engagement in this work. I'm really excited that you'll hear from 2 of our colleagues today. You'll hear from Priyanka Srinath, who's the Deputy Director of Mamta Health Institute for Mother and Child, which Matilda kindly introduced earlier. Briefly, this Mamta initiative was implemented from 2011 to 2015 and used a multi-sectoral approach to address child marriage in 2 states in India, with the aim of supporting the development of district-level convergent mechanisms. WHO supported the evaluation of this approach a few years ago and specifically assessed the processes used by the intervention to contribute to the formation of collaborative multi-sectoral efforts, 2, the impact of these processes on coordinated action, and 3, the key success factors and challenges encountered by the motivation. And Priyanka will share these with you today. Later in the webinar, you'll hear from Claudia Laforte, who's a consultant who has been skillfully leading the collaboration between ourselves at WHO and Girls Not Brides to generate lessons learned from the implementation of multi-sectoral policies and programs at the subnational level from different sectors other than child marriage. And as you saw from the examples I showed very quickly from the nutrition area, there are many lessons that are available to learn. So I'm really excited to hear what they have to share with you today and what Harriet has to share from the Ugandan context. So I'll hand over from here.
Great, thank you so much, Marina. And I'll now pass to Priyanka from Mamta to share the experience from India.
Thank you, Matinda, and thank you, Marina, for such a good overview on the topic today. Can we have the slides? My greetings to all the participants for this webinar. I'm from Multi Health Institute for Mother and Child, and Mamta is a Indian non-governmental organization working in the field of adolescence, maternal and child health for over 20 years now. A lot has already been presented by Matinda and Marina. I'll just take it forward from Marina's last slide. Can next slide, please? Right. So we all agree that child marriage is a multifaceted problem, and hence the solution doesn't lie with one sector, but many sectors. However, very little is known as how sectors can collaborate, coordinate, or converge to end child marriage. And for us in 2012, we also thought, is it possible, or is there any scope to integrate the issue of child marriage in whatever way it can be in the existing agenda of the different departments beyond the ministry? Next slide. So in this background, Mamta initiated this project that was supported by Ford Foundation, and the aim was to strengthen collaborative efforts across the sectors to address child marriage at a district level, not at the national level, not at the subnational level, but at the district level. And two high child marriage prevalence districts were identified. One was Jamui in Bihar, and second was Savai Madhopur in Rajasthan. The project was carried on for 3 years. A model was thought about, and we felt that the chief, the administrative officer, who is the district magistrate in the district, can lead the process. And with that, we should have also a mechanism where we can have a committee which is represented by the senior officials of different departments, coming together periodically to review and plan to address child marriage at the district and block or the village levels. So we identified Department of Social Welfare, Department of Health, Panchayati Raj, which actually works with the local governance, education and police as the key departments to start with. The entire intervention was in a cascade approach. So working with the district, instructions and directives flowing to the block level and then block level to the panchayat or the village level. The activities were largely around, because this was the first initiative of its kind and there was no existing mechanism as such to work on convergence. There was a lot of work done to advocate for the process and build consensus across the sectors among all the government officials to really come forward and participate. Technical support was provided to the department functionaries at district and block levels to carry out whatever key actions they actually adopted, and also help them prepare department specific training module on child marriage, help them conduct the trainings and capacity building of their department functionaries. Besides that, a district level NGO network, which also included media, was also facilitated to work as a pressure group and also facilitate the process of the government in implementing the law on child marriage and working with different sectors to reach out to the most vulnerable. Next slide. So evaluation, I will limit myself to the findings of the evaluation and not going into the experiences while doing the project. So the evaluation was conducted by WHO, Department of Reproductive Health and Research, and it was supported by Mamta. The aim was to understand how far project succeeded, how it contributed to the establishment of concerted sectoral and intersectoral district level efforts, and what were the challenges that the intervention faced. So the evaluation team, of course, to understand the context, they did a desk review to know about the relevant policies, programs, and various schemes that were applicable in the two states and the districts, understand the mandates of the different sectors. An extensive assessment was done with mixed method approach, wherein IDIs were conducted with the project staff, senior officials at the state level and in the districts. Surveys were conducted with the departmental functionaries and local elected members. Group discussions were held with the block level and with the NGO and media personnel, and also FGDs were done with the parents and the key community stakeholders. Next. Next slide, please. So how the project actually contributed? A lot of things that I already mentioned in the activities, but yes, project was able to get the approvals and directives from the relevant authorities at the national level as well as the subnational levels. But what it did not succeed in doing was to really translate those directives into regular follow-up by the nodal department at the subnational level with the districts and district authorities, as there was no agreed mechanism to do so. So if the nodal ministry was women and child, there were a lot of barriers in follow-ups to be done from the state to with the district magistrates and the departments at the district level. We also a lot of effort was put in to build the consensus. That was most important thing, but because participation and ownership of departments was critical to even kickstart an intervention of this kind. So we also tried to work with the departments to come up with a joint action plan and bring in some monitoring mechanism, though although it didn't last for long. But definitely in one of the district, that was Jamui, a committee was formed with the participation of different department functionaries to really come to review and plan periodically, so which was later actually merged with the Child Protection Committee, which came later, much later in the during the project period in the state. Of course, a lot of mentoring and technical support was provided at the block level, and yes, orientation and sensitization of local elected members was done, and it was very important because local elected members have a specific role assigned in implementation of the law, as well as in implementing some of the schemes which target prevention of child marriage. So that is very important to work with the Gram Pradhans and Sarpanchs. Next slide. So did this project allow for more concerted actions, and on what level, whether it was at block or district or panchayat or village? The evaluation finding says that tangible intersectoral convergence occurred at the village level, but progressively less at each successively higher level. It stimulated some informal coordination, but it could not contribute to the establishment of sustained joint work or working mechanisms at the higher level. But definitely what it did is, it prioritized the issue in the districts. Child marriage did become an important issue for the functionaries to look at. At the village level, at the block level, if you see a substantial proportion of Panchayati Raj members, frontline functionaries, they actually reported that the orientation changed their approach in tackling the cases of child marriages, and almost all of them said that they have underwent a sea change after this exposure. Vast majority also reported carrying out some actions in the communities in form of initiating dialogues, discussions, doing counseling to the parents, and also reporting cases, because reporting of cases is an issue, is a challenge. And even if we have a law there, we have 0 cases or very few cases reported from the districts. So who is going to report the issues of the cases of child marriage is very important. And you have such a huge HR from different departments actually there working in the communities, being there within that population that we're talking about. So some reporting of cases also started. So that was a good change that we look into.
I think we might have lost Priyanka for this last one, but you can see here on the slide the critical success factors and challenges there. Priyanka, are you available? We'll just try once, otherwise we'll move on to Harriet. 1 second. Okay, I think unfortunately we've lost Priyanka, so I will now pass over to Harriet Akulu from UNICEF Uganda to share their experience from there. Over to you, Harriet.
Okay, so thank you very much. I'm happy to join this webinar. And quickly, I will be talking about implementing the national strategy to end child marriage here in Uganda, focusing on some of the lessons and the challenges right now. Although I need to mention from the beginning that this is only our 2.5 year of implementation. So obviously there hasn't been any evaluation done yet. There is one that the ministry is planning for that will reveal perhaps more of the important lessons, but nonetheless, I'll share what we have. Also, another thing that I need to mention that in terms of the support to government among the UN agencies in Uganda, UNFPA and UNICEF collaborate through the global program to end child marriage in supporting the government of Uganda. Next slide. So I will try as much as possible to go through this outline, provide a little bit of the context that we have that was present at the time we did our national strategy, a little bit on the process, maybe not so much, and then the implementation. I will not necessarily restrict myself to implementation at the district level only, but I'll try as much as possible to touch on all of those elements. And then finally look at the challenges and the lessons, and if there will be any advice to civil society at all. Next slide. So in terms of how it all started in Uganda, I must just say that the time was right in 2015 when the government launched the national strategy. We had this adolescent girls vulnerability index report that the Population Council together with UNICEF and Ministry of Gender had just produced in 2013. UNICEF had received some small amounts from the headquarters, and there was a lot of global activism and movement towards this particular issue, which was really compounded well within, with the London conference in 2014, the Girls Summit in London, co-hosted by the government of UK and UNICEF. Threw a lot of light on these issues, and it was also at this conference that the government of Uganda made specific commitments towards ensuring that they have their own national action plan. And here I'll at some point also reflect on the role that Girls Not Right in Uganda played to ensure that some of these London conference commitments came to light. We then continued to support the ministry as UNICEF, and then in June 2015, the national strategy was launched. So the vision for the strategy is a society free from child marriage and teenage pregnancy, and its goal is ending child marriage and teenage pregnancy for prosperity and social economic transformation. There are 7 strategies, if you can go to the next one. Next slide. There are 7 strategies related to the national strategy. I'll not run through all of them, but I'll try as much as possible to touch on each one of them in terms of progress with implementation. So I need to mention that the strategy has been disseminated at national and regional level, and now covers about 57 districts, and 56 of these district local governments have adopted this this national strategy, and 25 of these, as of the end of 2017, have allocated their own resources towards the implementation. We track some of these things because we think it's very important in telling us whether there is progress in implementation of the strategy. We've worked together with a number of sectors in government and come up with a very comprehensive and a multi-sectoral program on adolescent girls. This is because when we started to have this interministerial engagement between the different sectors on these child marriage issues, we realized there were many things that needed to happen in order to improve the urgency and the status of the girl. And for that matter, this comprehensive multi-sectoral program for adolescent girl was championed, and right now it's championed by the First Lady, who is also the Honorable Minister for Education, and she chairs the interministerial collaboration and coordination. We have had national guidelines for prevention and management of HIV and teenage pregnancy in school setting, developed as one of the proposed actions within the policy. We had the cabinet approve our youth policy, and of course in 2016, as part of the activism that had commenced, the Child Act got approved and was assented to by the president. Next slide. So that was in terms of the legal policy environment, which is one of the pillars of the or strategies of the national strategy. Now, the second area of the national strategy is around evidence for programming. Now, there have been quite a number of studies which have been conducted, which have significant impact in terms of telling us the situation. We have not had an evaluative assessment or research. We plan to do one very soon, but those are the listed. You can see those are some of the studies which have now been completed within this framework. We had a formative research on child marriage. Naturally, this was to understand the social norms more concretely that are underpinning this particular practice. Ministry of Gender also carried out an assessment, the social institutions and gender index, SIGI, on the adolescent girl. This was also done. We also had the National Adolescent and Youth Sexual and Reproductive Health Assessment, piloted by UNFPA and Ministry of Health, and then the Youth-Friendly Health Service Delivery in Uganda report was also completed. One of the significant issues around health and child marriage was the absence of youth-friendly services that girls can go to, and boys, so that teenage pregnancies are averted. So this was one of the things. So we also had an adolescent health risk behaviors study that was done in Uganda. This involved both the academic institution and the UN, meaning WHO, UNICEF, UNFPA, and a number of other entities that work together on this. So these are just a few evidence pieces that have been put out there. Further analysis in terms of what this is saying definitely is critical. Analyzing all these pieces and coming up with something substantive is very much needed. Next slide.
Hi, Harriet. Sorry, Matilda here. Just in the interest of time, would you be able to just go through the intervention areas quickly and towards the lessons learned? Sorry.
Next slide. We had one of the other strategies or areas that we needed to work on was also change in communities' behavior and social norms. We have rolled out several initiatives on social norms at different levels in the country, involving civil society organization and districts. Those posted numbers are particularly numbers that we have obtained in 2017. We've seen several goals being reached, and we have also seen several dialogues held, resulting in so many public commitments and declarations at that level of the community. Next slide. So in terms of increasing access to quality protection and education services, that's another pillar. Also, we have registered some progress. I will not go through this because we need to move in the interest of time. Next slide. Similarly, I have already mentioned that in terms of establishing and strengthening implementation structures, those are what we have so far done. I'll not dwell on that. Next. So we have already talked about, I have slightly highlighted some of the coordination and monitoring functions that the government has been able to put in place, and colleagues can have a look at this and go through it later on. Next slide. So in terms of challenges and so far the lessons we've learned, this is not far from what the previous speakers have also alluded to. One of the critical challenges for Uganda is the resource envelope to the social development sector as a whole. The Ministry of Gender, Labour and Social Development receives 0.8% of the national budget. And at UNICEF, we are already beginning to think of innovative financing as a potential solution. This involves the public-private partnership. There is some movement towards an endowment fund for girls. It's being conceptualized together with the private sector foundation and Ministry of Finance and Ministry of Gender. I don't have a lot of time to go into detail what this is. We will be assessing preliminary outcomes of implementation of the national strategy. We are at the level of concept, which is still being discussed. One of the other issues that we have found or as a challenge is measuring challenges. I mean, not measuring challenges, I think it's a typo. Measuring the outcomes of social norms work or change. This is not institutionalized. The administrative data sources which are available, just like national surveys, do not capture issues of social norms. So that's a big challenge, particularly when it comes to implementing the national strategy for child marriage, whereby we are dealing with a lot of social norms issues. So indicators to measure social norms change and how to measure social norms change is an area that we need to invest in. Next. Again, having a national, this is from what we have seen, having a national strategy in a context of decentralization like in Uganda here, does not necessarily mean that this plan is going to be implemented at the national level. What we have had to do as UNICEF is to really support consensus building at district level. Not always do people agree, even when consultations were as wide as in the case of Uganda in all those regions and district level. When it came to implementation, there were definitely some levels of resistance. Also, there are capacity issues. First of all, understanding what it is child marriage, for example, is a problem, because first of all, who is a child? People define it differently whenever you move away from the legal perspective. Again, plans have to be integrated. The district development plans have to integrate child marriage in order for it to be implemented. In the case of Uganda, it is not automatic because districts are also semi-autonomous and they run their own plans and their own budgets. So if you have a national strategy, it doesn't mean that the district will automatically mobilize, and put and implement. Again, resource allocation, we have found that maybe to help up this work, it is very important to ensure mobilizing resources is done through council. In Uganda, council is the political wing of the local government. We have a number of cases where council comes up and decides that for every amount of money that comes into the council budget, 5% or 0.5% is devoted towards implementation of the national strategy. In such cases, it becomes very easy to realize resources, because now what they also do is to ensure that they have included the issues of child marriage in their plan. They may even allocate resources, but they may never realize. And if they realize, they may never utilize. So it's critical to look at allocation, realization, and utilization of resources. In all of this, as UNICEF, we think there is definitely a big role for civil society organizations. From what we have seen, again, reflecting on the role of Girls Not Bright here in Uganda after the London Girls Summit in 2014, they constantly reminded and held government accountable, but also I think that NGOs are positioned to bring local evidence to the table for meaningful advocacy. And again, building of this whole society movement and tackling social norms is something that the NGOs are really better placed. And of course, supporting access to services for girls and boys. As you know, the services, whether it is protection services or it is social services, they are provided through state institutions, but sometimes the state institutions are at levels where communities cannot access, so the NGOs play quite a critical role. I would say conceptualizing a program that seeks to challenge social norms will also require wide consultations at all levels of government. Everyone generally has to be on board, and I noticed that in the previous speakers' slides, there was also something like that. Next, please. I need to mention that the work in Uganda is not only supported by UNICEF and UNFPA. There are quite a number of entities, civil society organizations and partners that are working to support the implementation of the national strategy. Needless to mention BRAC, the Church of Uganda in particular, DFID, the EU, Girls Not Bright, the local alliance, COICA, the Korean International Cooperation Agency, and Netherlands Development Cooperation Plan International, obviously UNICEF and UNFPA, who have championed this, and World Vision. So briefly, I can end here. Thank you very much.
Thank you so much, Harriet. Absolutely fascinating. So thank you so much for sharing. Now I'll hand over to Claudia Laforte, the consultant from Child Frontiers, who is conducting the research on lessons learned from other sectors at the subnational level.
Thank you, Matilda, very much. I feel that my presentation ties in very well with a lot of the findings that emerged from both the India and the Uganda case study. But just to jump into the presentation, the purpose of this research is really to identify sectors with the strongest lessons on subnational implementation of multi-sectoral policies that could be applicable to implementation of child marriage strategies, identify and document examples of best practice where they exist, and then to draw lessons from multi-sector and multi-stakeholder implementation processes in terms of both operationalizing a multi-sectoral approach and what are the mechanisms needed to do so. Next slide. The methodology of this research was purely desk-based in that it involved a review of 50 online source academic policy articles across different sectors, in particular HIV/AIDS, nutrition, mental health, maternal health, and GBV and then violence against women. And I should point out that we chose these sectors eventually because we thought that they had the most applicable lessons for multi-sectoral implementation for the context of child marriage. The evidence from these factors point to the fact that these policy areas do require multi-sectoral interventions. And also we quickly learned from the desk review that these were effectively the policy areas for which multi-sectoral implementation had been documented actually through academic articles. Having said that, it's important to point out also that there is a lot of policy work happening out there, and the Manta case study and UNICEF Uganda case study show that. That, however, is not being perhaps captured from academic articles, so it is important to stress, let's say, this limitation of the research. From 50 online source articles, I long listed 27 articles that clearly documented multi-sectoral policy implementation processes. and with specific criteria for selection, which included regional variation, evidence around the effectiveness or the impact of the multi-sectoral collaboration, whether there was collaboration at scales, and whether there was evidence or at least data around human rights, gender equality, or equity issues. From these 27 articles, we narrowed down to 9 articles, which were selected for additional key informant interviews, and 5 which will become in-depth case studies. And I'm using also snowballing to try to cast a wider net, let's say, of key informant, precisely to tap into this wider policy work that is happening out there, but that is not maybe rigorously evaluated or documented. Next slide. So I have highlighted in this presentation some of the very top-line takeaways from the evidence and the initial key informant interviews that I have conducted so far, articulated around issues of policy formulation and use of evidence, and in terms of what we know on how to conduct national to subnational policy implementation processes. So around policy formulation and use of evidence, the documents and the documents review really show complex and politicized processes of policy formulation and implementations, where different actors frame the issues around nutrition, HIV/AIDS, gender-based violence, etc., from their very own different position and agency mandates. And for this reason, it is very important to develop a common definition, or as Marina said earlier, a common vision of the issues at stake, so from the very, very beginning of the process. This points also to the use and the importance of strengthening the use of rigorous evidence, because across the various sectors, issues are generally first framed on the basis of evidence from relatively small sample data, like DHS, or in the case of child marriage, for example, MIGS, and especially very little consultation with populations. So mostly quantitative data, but very, very little qualitative data that actually capture the wide variety of practices and understandings of the issues at stake. But also where to actually prioritize work in ways that go beyond high prevalence rates or high burden areas. Another aspect is that of, attached to the use of data, is that of M&E. Again, the documents really show that they may be present at national level, therefore attached to a national strategy or an action plan. But when it comes down to local level, M&E is very much lacking. Just one quick reflection around the role of global donors. Just like the Uganda case studies show, they often give the impetus of the momentum to focus on specific areas, and then the government follows suit. But then it is important to work with existing structural mechanisms, and I've seen, for example, in the HIV case study, some of the global donors encourage the setup of parallel structure to local and national structures, which really begs the question of sustainability. Next slide. In terms of implementation, very practical implementation processes. So the presence of champions, such as doctors, NGOs, or even magistrates, as the case in Rajasthan, or the media, or when issues are housed at the highest level, for example, at the president's level, or the cabinet's level, or the first lady level, like in Uganda, they all seem very effective to initiate action at the national level, and then that action to trickle down at local level, and in general for the issues to be considered sufficiently important to be budgeted for. So champions seem to be really leading here, and an important policy element. At the level of implementation processes, all documents reviewed really show the push to set in place multi-sectoral national coordination structures in the fashion of executive committees, national councils, working groups, etc. But for these structures to really be effective at local level, the mandates, roles, and responsibility of all the actors need to be very clearly outlined, communicated, and then eventually reflected locally. And it seems quite a logical thing, but actually the evidence from the documents review show that often these structures remain very much national, but then very little communication at local level take place in terms of understanding who should be doing what, where, how, who leads in which sectors, what are the lines of communication across these different sectors, but especially also the lines of accountability remain unclear. Next slide. So this points to the need for appointing a very skilled leadership at local level to coordinate precisely these multi-sectoral actions, negotiate the different agendas of the different actors, but also maintain neutrality, and at the same time document the actions, the gaps, the needs of communities at local level, the needs of local staff on the ground, and especially in the case in which this leadership faces high turnover. Another point to stress from the policy review is the support to the local workforce. A lot of these national policies and action plan and then the standard operating procedure that maybe come with some of the health sectors in particular, point to the need of communicating, disseminating and training local actors on what these national policies are, what the standard operation principles or procedures are, what guidelines are, but also on how to review and use data that they may be picking up and collecting on a regular basis on the field. Next slide. This slide covers the relationship between government and civil society. I mean, clearly the evidence shows that collaboration and trust are necessary, and the India case study really showed that to make the coordination function. In some cases, the evidence showed that civil society should not take over essential government functions in terms of service delivery, or the advocacy role can be undermined. But at the same time, civil society should really be seen in its policy development role, not only as an advocate or criticizing, let's say, the role of the government. So the civil society really has a kind of a role to juggle here, in a sense. And as it was pointed out from the other presentation, definitely the civil society can provide technical support to local authorities, for example, in the ways of budgeting processes or setting up proper budgets, but also definitely bringing in the community perspective, especially of the most vulnerable and remote population. Next slide. Quick note on the role of the private sector, which is growing very much in importance in international development. There was very little documentation on the engagement of the private sector, but apart for HIV sector. But in some areas, it was found to actually undermine the role of the government because it was taking over key government functions. And finally, a note on budgeting. This is a very important issue that came across absolutely beyond belief across all the evidence reviews. Often lacking is clear allocation of financial resources or simply budget lines at local level to find the appropriate local, multi-sectoral local activities. But also what is lacking are clearly defined cost sharing mechanisms and sharing of allocation of resources. Next slide. So just a few questions and reflections, again, arising from this very top line work. Are there differences in policy implementation between strongly centralized systems or devolved systems? And I think Harriet had very much the same question from the Uganda case study, because policy implementation may take place very differently in these different systems. Privatization of certain services, does it counter the central role of the government? Does it need to be more regulated? And do we need to do a bit more work and studies around this? Donor zoning, and does it deliver where the need is higher? And especially, is it based on evidence that goes beyond prevalence or burden rates and rather around the needs as articulated by the communities? We talked about the role of civil society and the negotiation between being a policy developer and implementer, but also maintaining a strong advocacy role. And then finally, the use of evidence, how to go beyond the evidence from small sample data sets and really ensure this qualitative information to inform decision making and to capture the diversity of settings, of populations and practices. Thank you.
Can you hear me? Yeah. Okay, sorry about that. Just to recap, unfortunately we don't have enough time for questions today, but we will be sending out an email to everyone who attended with further information regarding the research, which will be available, report and recommendations on what we're learning and what different actors can do in terms of their role in implementing at the subnational level. That will be available in late June. And just to also mention that a lot of this work will lead into this big question around costing and financing child marriage interventions and financing these national strategies. So in the latter half of the work and in 2019, we'll be doing a lot of work around budget advocacy. So we can keep you in the loop on that. We will be uploading this webinar website with a recording and the related resources and reports mentioned. And a quick reminder that our next webinar will be in the week of the 14th of April, focusing on the criminalisation of child marriage and the values and risks of this. If you're not already subscribed, you can find it on our website. Thank you again to everyone for joining, and please keep in touch. My email is matilda.branson@girlsnotbrides.org. We'll be following up with an email after this. So please don't hesitate to contact us if you have any questions around what was touched on today. So thank you again to our speakers for joining us, sharing their knowledge and experience. It was really great, and do keep in touch. Thank you.